Welcome to Health Facts with Normanie Ricks. I am your host, Normanie Ricks. I like to start off each episode with a little known health fact. Did you know that there were different parts of the nervous system? The brain is part of the central nervous system, the brain and the spinal cord, and then there's the peripheral nervous system, which are the nerves that go to your body and control the motor and the sensory aspects. There's also a part of the nervous system called the autonomic nervous system, which controls things like breathing, respiratory rate, heart rate, and things like that. So I have the honor and privilege of having Dr. Steven Sideroff as my guest today. He is a professor at the University of California, Los Angeles, UCLA, and he is a recognized expert in the field of resilience and neurofeedback training. Welcome to the show, Dr. Sideroff.
Thank you, Normanie. It's a pleasure to be with you.
So, what would you say is the thing that brought you into being an advocate for resilience and brain health and excellence?
Well, I actually started out my career doing brain research, and I was very interested in understanding how the brain learned and stored memories. And that's what got me into the field. But very quickly, I realized that I was more interested in working with people than in sitting in a laboratory doing research. And so I moved into the area of clinical psychology. But one of the things that I took away from my brain research was the importance of stress in all of our lives. You can be doing pretty well in your life until the stresses start to build up. And when that happens, it really strains your ability to cope. And when that happens, systems tend to break down. We become more emotionally reactive. And so we tend to not function as well as when the stresses are low or when we are better able to handle stress. And so I actually began doing workshops in stress management. And the interesting thing is that everybody says that they're stressed out, but then it's very difficult for people to really do things that lower their stress. And part of the reason about that is our ambivalence around stress, because stress isn't just bad. Stress, there's a good aspect to stress. If you think of all the times that you were successful in your life, when you accomplished something, all of those positive experiences, positive episodes in your life were always typically accompanied by stress. So we don't want to talk about reducing stress, managing stress. We really want to talk about the best ways of living with stress. And that's when I moved into the area of resilience.
Okay.
Because resilience is about, go ahead.
I was going to say, I was reflecting on times in my life where I had to, I guess, be put on the spot or take a big test. And I guess that's more nervousness and maybe like some anxiety. But I guess what we're talking about is like chronic stress that starts affecting your health.
That's right. It's when it's ongoing. And I know you like to have your guests talk about one important fact, and I'll give you one important fact, and it really impacts all of us, and that's that we have an evolutionary mismatch between the environment in which our stress response developed, which was the hunter-gatherer environment of 10, 50, 100,000 years ago, and our current environment. And so even though we carry that same stress response, which is what we refer to as fight or flight, if you think about the stresses in your life, how many of them can you actually deal with by either fighting the danger, fighting the stress, or running from it? Almost none of them, right?
No.
And so our bodies mobilize for fight or flight with any of our stresses, bills that need to be paid, uncertainty, COVID, virus, a war in Europe, all of these things that are activating our stress response, but then we have to hold in that energy, and that's what really begins to create problems, is the buildup of our stress response, but unable to dissipate it or do something with it, relax and recover. And so that imbalance is what actually results in dysregulation of our nervous system.
So do you coach people to have an outlet for this stress?
Well, that's one of the ways of dealing with it. So if something makes you angry, but your boss, for example, is making you angry, and you can't really express that anger there, that doesn't mean you can't find some other way of getting that anger out. Mm-hmm. And in fact, that's your responsibility, to find some way of releasing that energy around that anger so that you could then calm your body back down and recover from the stress.
Okay, that sounds awesome. I know that most people say, okay, yoga, exercise. I know you advise like neurofeedback training. Can you talk more about the neurofeedback?
Certainly. Yeah, so again, when we're stressed, we activate our nervous system. You talked about the nervous system earlier. Mm-hmm. And we have two branches to the nervous system: the sympathetic, that activates to stress, and the parasympathetic, the opposite, that we want to engage so that we recover after stressful events. But because, think about your day. Think about all the stimuli in your day that can activate your stress response. Mm-hmm. Throughout the day, conflict, uncertainty, worry about different things in your life, things that you have control over, some things that you don't have control over. So they're all activating your nervous system. But again, think about your day. How many stimuli that you have in your day trigger your relaxation response?
Hardly none.
Right. So think about how we keep ratcheting up, but we don't give ourselves the opportunity to recover. And that literally throws our nervous system out of balance.
Okay.
Biofeedback is a way of helping a person literally learn to reestablish a balance to their nervous system. Because what biofeedback does is it monitors some aspect of your physiology, such as muscle tension, mm-hmm. and trains you to lower that. Excuse me. Neurofeedback is a very special type of biofeedback in which you monitor your brain waves.
Okay.
Now, it's quite amazing because with biofeedback, neurofeedback, some of the things that are inside of us that we don't have access to, now we have access to. So we monitor our brain waves, and we can literally, by putting the information on a computer monitor, we can actually feed back information about your brain waves, and you can actually learn to increase certain parts of your brain waves and decrease other parts of your brain waves. So, for example, alpha rhythm. You've heard of the term alpha rhythm. It's an aspect of brain waves mm-hmm. that are brain waves that when you increase them, it establishes a greater sense of calm in your body.
Okay.
So we can train someone to literally increase the amount of alpha rhythm that they have, and that helps calm them down. We can also, for someone that has attention deficit disorder, has difficulty staying focused, there are other components of our brain waves that have to do with focus and attention. Mm-hmm. And we can train that person to increase those frequencies to be more focused and attentive. So that's what neurofeedback can do, and it's used for a lot of different emotional, mental and physical symptoms.
So where can a person go and request to get this done so that they can learn to control this? And how long does this program take to train yourself to do this?
Well, like any training, it requires practice. So it requires a series of training sessions. Mm-hmm. So some of the benefits you can experience after just one session. In other words, if I was increasing alpha rhythm, I will notice being more calm after a 15, 20-minute session. Mm-hmm. If we're trying to literally help the brain go into a better state, like being able to focus better, being able to have the prefrontal cortex, that's where all of our executive functions lie, it may take 10, 15, 20 sessions to get improvement there.
Okay. So I can think about if I was in a neurofeedback session and I want to calm my brain, I probably would think about the beach and like the water and stuff like that. But if a person has something like a chronic pain syndrome or something like ADD or ADHD, like how do you make them overcome that through neurofeedback?
Well, those conditions that you just mentioned have multiple factors that contribute. So, so you would want to learn more about that person, find out about their lifestyle, find out about the way they think. For example, if I am always expecting danger, mm-hmm. my nervous system is going to be continually activated. Mm-hmm. On the other hand, if I'm always expecting things to go well, I won't be activating my nervous system quite as much. And so expectation, which is, a factor of our history and training, all of these considerations come into play when you look to help a person with any of these kinds of symptoms.
Okay, so you kind of mentioned trauma. So I know that you are a professor in the field of psychology. So how does this tie into trauma?
Well, trauma is, and we can say it's an extreme form of stress. Mm-hmm. Trauma typically occurs when something extremely dangerous happens and a person doesn't feel like they have an exit, an escape. Mm-hmm. So they're sort of stuck with something that's maybe life-threatening with no way out. A car accident, an attack, abuse, all of these things can lead to trauma. Mm-hmm. And so one of the things that happens with trauma is it affects our nervous system in various ways, again, leaving us less capable of dealing with normal daily activity, daily situations, because it throws our nervous system out of balance. And so biofeedback, neurofeedback are ways of helping restore balance to the nervous system, to restore resiliency to the nervous system.
Okay. So I know that you speak a lot on resiliency. So can you talk about your book that you've written about resiliency and how you tie that into when you're teaching your students and when you have patients and things of that nature?
Certainly. Resilience right now is a very important and necessary topic. In fact, when the pandemic began a couple of years ago, I began sending out resilience steps that people can follow on a daily basis to help them cope with what was initially a danger that we that we had no answer to. It took a year before we had the vaccine. Mm-hmm. It created huge levels of uncertainty. The amount of emotional distress and upset in our country and around the world went quite a bit higher because of this level of uncertainty.
Right.
And so what I've done is I put out messages on a daily basis and it centers around my model of resilience. And that's presented in my book, The Path, Mastering the 9 Pillars of Resilience and Success. And so I lay out a model of resilience that has 9 components.
Okay.
And so let me mention them right now, because each of them in some way contribute to each of us being more resilient, more optimally functioning. So the first 3 have to do with relationship. The first one is the relationship with the person that you're in most contact with.
Okay.
And that is yourself.
True.
And so the first pillar is your relationship with yourself. And that means having a good relationship with yourself, being loving to yourself rather than critical and judgmental. The second is relationship with others. And that's about being able to have and establish healthy, nurturing relationships with other people, and being willing to set healthy boundaries so that people don't take advantage of you, and so that you don't absorb toxic energy from other people, which also leads to being able to discriminate between people that you can have healthy relationships with and people who it's more difficult to have healthy relationships with. The third area of relationship is relationship with something greater, and that's your spirituality. It's having meaning and purpose in your life, and it's giving service. So the third level of relationship connects you to the larger world in different ways, and having healthy relationships in that regard.
Okay.
The next 3 areas have to do with organismic balance and mastery. So the first one is physical balance and mastery, and that I've alluded to already. That's being able to recover quickly after a stressful event.
Okay.
Most of us go from one stressful event to the next, and even when there isn't a stress, we're on the lookout for where the next danger is. And so we maintain the activation of the nervous system. Very important to notice places and times where you could say to yourself, I'm safe. I can let go, I can let down, so that my nervous system can recover from other stresses.
Okay.
The next one is mental balance and mastery, and that's having a positive outlook on life and on yourself. That's having positive expectations. So you wake up in the morning and you look for what good is going to happen rather than what the problems are going to be. A lot of people wake up and they're anxious, they're nervous because they're already wondering where the dangers lie, whether they're going to be able to do something that day or not. The next one is emotional balance and mastery. And that's being tuned into your emotions and being willing to look at the difficult, painful emotions that sit inside of you. Mm-hmm. Emotions don't go away by themselves. That phrase, time heals all wounds, not correct. You have to consciously address unfinished emotional business and work through it so that you can then let them go. And the last 3 have to do with how we engage in the world. Presence, ability to be present. Mm-hmm. Flexibility, the ability to make adjustments if your path is thwarted by boundaries like many of ours have been over the last couple of years. Flexibility is being able to change your goals, change where you want to get to in order to be more successful. And then the last one is power, which I define as the ability to get things done.
Wow.
So this is the model that I work to train people on. Each one of these components contributes to your being more resilient.
Wow. It sounds like you covered all the bases. I definitely could relate to the waking up in the morning and thinking positive. I think a lot of people now are calling that like positive manifestations or meditation in the morning, but like just kind of trying to start your day with a positive outlook calms down your nervous system.
It definitely does. It's a way to recognize that we have control over a lot of what happens in our body and our nervous system, depending on where we place our focus.
Okay. Well, I know that you also teach in the rheumatology department. How is rheumatology related to any of this?
So I have a joint appointment in rheumatology, and I have that joint appointment because a lot of the work that I do relates to physical symptoms.
Mm-hmm.
And it's the direct connection between stress, emotions, psychological, and the physical. So the more our nervous system is out of balance because of how much stress we have in our lives and our difficulty recovering or taking the time to recover, a nervous system that gets out of balance, we refer to that as dysregulated nervous system.
Right.
And
I'm sorry, can we speak on some of the conditions that occur as a result of a dysregulated nervous system?
Yes, of course, because some estimate 70, 80 or more percent of doctors' visits are the result of stress and a dysregulated nervous system. So the dysregulated nervous system is a physiological consequence, but some of the main causes of that are too much stress or stress that's not well handled. Mm-hmm. When the nervous system is dysregulated, it leads to all kinds of physical symptoms. So a lot of the symptoms that a rheumatologist handles are the result of this dysregulated nervous system. Chronic pain, fibromyalgia, all of these can be traced back to stress reactions that have direct impact on the functioning of the brain, mm-hmm. and even impairment of the brain. So the research has shown that when you look at the brains of people with fibromyalgia, one of the areas that's directly impacted by stress is you could look at that in an imaging, and it's a shrunk area of the brain. Mm-hmm. It actually is morphologically different than a healthy brain. So stress and how you deal with stress is a major factor in a lot of these symptoms and illnesses.
Right. So I know fibromyalgia and complex regional pain syndrome are a lot of what people go through. And because you can't physically see pain, they might think that a person is faking or making it up, or it's all in their head. So I think that is great that you're teaching about this and that you're speaking about this and you're teaching your students about this so that these people that are going to be professors and doctors can come out into the world and know how to deal with these different complex pain syndromes.
Yes, and in fact, I teach in the doctoring program at UCLA. So my students are medical students and dental students. Mm-hmm. And that's one of the things that I teach them about is the impact of emotions, the impact of stress on physical symptoms.
Right. So what is your number one, I guess, takeaway if you could leave a person with anything and they can take it for the rest of their life, what would you say?
So it's a very good question, Normanie. And one of the things that I lead with in how people can deal with the pandemic and now the uncertainty resulting from the war in Europe is to realize that there's always a best way to deal with whatever's going on in your life. And that's a very important concept. There's always a best way. because a lot of times people come to me with all of their stresses and all of their problems, and they feel helpless. They feel like it's what the world is doing to them. Mm. And so instead of going into what's wrong, I can tell them there is a best way for you to deal with all the issues in your life right now. Now, it automatically puts their focus on what is that best way. And as soon as they do that, now they're taking responsibility for their life. Now they are, okay, let me find that best way. Mm-hmm. So it automatically shifts them into a more positive way of approaching their life, their situation in the moment.
Okay. So we're talking about all of the different things that's going on around the world right now. So can you talk about some of the things that you've established in other countries and how they're using those things?
Sure. I've helped to establish behavioral medicine programs in China, in Europe, and other places. But we need all of this right here at home as much as any place else. And, it's also important, one of the things that we're also focused in on these days is racial issues and how people of color have been really targeted in certain ways and have been, victims of different structural factors in our society. And people of color suffer more than any other groups in terms of mental health and in terms of stress, because they have to deal with so much more in their lives. Mm-hmm. So while recognizing that these are the conditions right now, and we have to do whatever we can for equal justice and to help everybody have the same benefits, the same rights, it's also important to realize that no matter who we are, we have ways that we can become more resilient. Anybody can become more resilient. Anybody can learn these kinds of techniques to help them deal with whatever their situations are, while they're trying to address equal justice as well.
Right. I think that's a great point. I think that when you do the research, there are a lot of people of different ethnicities and backgrounds that have more chronic illnesses than others. And I guess you can trace it back to the trauma response, the stress response, the day-to-day stressors. So that makes a lot of sense, what you just said.
Right. And yes, there are a lot of things we don't have control over. Mm-hmm. We don't have control over the increased dangers if you're going out on the street, if you're a person of color. Mm-hmm. At the same time, it makes it even more important to find ways of becoming more resilient.
Sure.
Right? To find what is within your control that you can do something about. Mm-hmm. So, for example, we talked earlier about how many stimuli in our day trigger stress and almost none trigger relaxation. Then it's our responsibility to take time to practice relaxing.
Right.
So, in fact, if people wanted to go to my website, drstephensideroff.com, I have a free audio download of a relaxation visualization exercise that people can download and they can practice on a daily basis.
Okay, that's awesome.
Just like any other skill, mm-hmm. The ability to relax requires practice.
Mm-hmm. Yeah, that's a great point. Do you have any other strategies that people can use just on a day-to-day?
Yes, there are a lot of strategies. Again, one of the things that I'm doing right now, I'm going to be starting in the next couple of weeks, is a new daily resilience program Again, people can go to my website and sign up, and they will receive in their email box every day 1 5-minute point of something that they could do that day to help them be more resilient. So some of these messages have to do with how you think. Mm-hmm. Some of these messages have to do with establishing a healthier relationship with yourself, which I indicated is my number one pillar of resilience. Mm-hmm. Some of these have to do with how to talk to people so that you get your needs met, how to be able to notice your needs in the first place. A lot of times, particularly emotional needs, we tend to push them down if we are not certain we'll be able to get them met.
Right.
So rather than notice we have these needs, we push them from our awareness. And of course, when you do that, you'll never get your needs met. So it's important to allow them to come up. That's the first step. And then talk about how you can engage with people in your life to get those needs met.
That's great. That's great. So can you please leave our audience with the 2 books and how they can find those books and how they can get in touch with you and how they can find centers across the United States like the one you offer so that they can get help?
Sure, of course. So my current book, just have a copy right here, is The Path, Mastering the 9 Pillars of Resilience and Success. Mm-hmm. And it's available at Amazon.com.
Okay.
My next book, which is coming out in May, is called The Resilience Response. Mm-hmm. And that goes further into models of resilience and how to do things on a daily basis to become more resilient. And that's the key. That's the notion of my title, The Path.
Okay.
A lot of times, and this is very important, people, when they think of becoming resilient, of dealing with stress, they very quickly get overwhelmed because they think of all the different things. I have to get more sleep. I have to start eating better. I have to practice a relaxation exercise. I have to deal with my conflicts, etc. The notion of the path is that we can only do one thing at a time.
That's right.
No matter how much we have to do. And the more you can stay focused on what I could do right here, right now, these next 15 minutes, the next hour, and work through that before you go to item number 2, item number 3, you'll be much more effective. Okay. And when you do that, that's being on the path.
Okay. Okay. And then how can people find different centers in the United States to get them on the right path?
I think everybody has access to the computer, the internet, to Google. I think there are many different people offering. It's about finding the right person. Mm-hmm. There isn't one website that has everything that everybody can need or can use. I have a lot of resources on my website, drstephensideroff.com. If someone has a particular question, they could send me an email, and I'd be happy to respond to them. My email address is on my website. A way to contact me is available, and they can sign up for my mailing list. Also, let me mention that I just had a blog published on psychologytoday.com.
Okay.
So this is a very current blog that I address current issues of resilience. So if you go to psychologytoday.com and you put in my name, my blogs will pop up. So that's another good place to start. In fact, they have resources at Psychology Today as well.
Okay, awesome. Well, thank you so much. It has been an absolute pleasure having you on the show today. And thank you for all your wisdom and your knowledge. And I think what I heard you say is you have to kind of take some self-responsibility in this thing.
Right. That's behind what's behind resilience. So Normanie, it's also been a pleasure to have a conversation with you, and thank you very much for inviting me.
All right. Have a good day.
You too. Bye-bye.